Alright, it's week 8, spinal anatomy. Forgot to make a Zoom link. Oh no, that one's going now. Holy fuck. What the hell, dude? These fucking lights. Alright. Okay, great. Now let's get this up here in Zoom. Got plenty of time. Zoom. Meaning. Check 1, 2. Check 1, 2, 3. Check 1, 2, 3. Check 1, 2, 3. Check 1, 2, 3.
This meeting is being recorded.
Hi, Nick. Can you hear me okay?
Yeah, I can. Can you hear me?
I can hear you loud and clear.
Perfect.
And you can see the picture okay?
Yep, looks good.
Great. We'll give it a few more minutes here. See if anybody shows up. Do you guys have a test today?
We had a test today. What was it? I can't even remember.
Can't even remember.
Oh, it was philosophy.
So philosophy. That's not hard, is it? Philosophy?
No, it's not bad.
Yeah, that's good. You have enough hard classes.
That's right. We have a histology test on Wednesday. Then we have a physiology test on Friday.
Oh, jeez. Yeah, it keeps coming right out one after another.
Next week's not looking too bad, though.
Oh, that's good. Get a little rest before the finals kick in.
That's right.
Great. Let's see. I probably don't need that up. Did that make the bones here? Did that make it look bigger when I just did that, or are they looking about the same to you? That versus that.
I don't see anything happening. I have mine on full screen, but
okay. But you can see it plenty good enough.
Yeah, I think that's pretty good.
Okay. Let's see. Guess it's better to hide that. All right, well, let's get started. I guess it's after 2. Well, we'll give it another minute or so. Anybody have any questions about anything? You guys' brains are too burnt out to even think of a question. Well, let's get started. Because I know you got things to do and tests to study for. All right, so we're going to go over atlas, axis, and this thing. And you're pretty good because it's very similar to the lumbar spine. So you should be pretty good at it. This is, if I kind of move it here, this is a cervical motion segment, a C5 motion segment. But now we can see all the stuff that's inside the canal. So let's go through this stuff. So this, of course, is the spinal cord. Now we don't have a cauda-equina anymore. We have a real spinal cord. Where are all the tracks? Where are all the cauda-equina nerve roots? They're all embedded in either the white matter or the gray matter here. So what I did yesterday, I asked him this question. If you're going to, let's say you're going to be a spine surgeon, and you're going to take a tumor off this dura mater right here. What are the layers that you have to go through to get to the pia mater here, or to get to the spinal cord itself? So the first one is going to be lamina. That's easy. Everybody missed this yesterday, both groups. Anybody have any idea what that is, that layer? No guesses. What is that? Some more people coming in. What is that layer? That is ligamentum flavum. So lamina. And you guys who just joined us, you haven't missed anything. We just started. I started by saying if you stick a pin through the lamina, what are the layers? Or if you're a spine surgeon and you need to do surgery and get all the way down to the spinal cord, what are the layers that you'd pass through? So we have the lamina, we have ligamentum flavum, and then we have a weird little place right here. So this is this little yellow stuff. That's fat. So that is, you could call it epidural fat. You could call that the the epidural space. This is where epidural steroid injections are injected into here. So that's the next area. This is also, there's a venous network here. This is also called the posterior venous plexus, or posterior epidural venous plexus. And this would be the anterior epidural venous plexus right there. All right, so let's keep on going. So then we would hit this layer. So that's the thecal sac, or the dural sac. So that's dura mater right there. And notice how the dura mater actually, it extends outward, and as the nerves bud out of the thecal sac, the dura mater is taken right with it. Up until this point, this is the end of the dura mater right here. And it turns into the epineurium, which is really just kind of the same stuff. It's a connective tissue. All right, so then we have a very thin layer. I'll put the tip of my probe right on it. It's right there. So that's arachnoid mater. That little tiny black line, that's a potential space. So that's called, it's called the subdural space. You've heard of a subdural hematoma? Well, that has that you could leak blood into this space and it could blow way, way up. So that's a subdural hematoma. Once you get through the arachnoid mater, now we're in this big space right here. So that's called the interthecal space. Interthecal space. Or you could say it's the subarachnoid space. Subarachnoid space. And then finally we run into the spinal cord, but the coating around the spinal cord here, that and that is pia mater. Pia mater. Right? Let's see, what else do I want to tell you? Let's follow these nerves now. If this is C5, so this would be, if this is C5, this is actually the C5 spinal cord level. This is all C5 property, right? The question is, if there was a disc sitting here, what disc would be sitting right on top of this? That'd be a good question, wouldn't it? C5? Nope, that's the C4 disc would sit right there. All right, so let's follow these little nerves out. Now we know what that is. So that's the dorsal root ganglia. So that's part of the sensory nerve. This is the sensory nerve root then, right here. But then it gets a little weird looking. There's all these little strings. You can see them actually on this side really nice. See how all those are? Those are called nerve rootlets. Nerve rootlets. They're kind of hard to see here. But they span the entire spinal cord level. So if this is I forget what we said this is, C5 I think we said. If this is C5, from here, kind of coming out of the plane of the page, this is all the C5 spinal cord level. And that's measured by these roots here. All right, so this guy right here, that would be the motor root. So sensory root, motor root. They come together, and then underneath here they merge into one big nerve. Now we have the epineurium on the top of it still, so you can't see, but they would merge into one mixed nerve. So this area right here is called the spinal nerve. Spinal nerve. The end of it is right here, kind of ends, because the spinal nerve splits into this branch, the ventral ramus, and this branch, the dorsal ramus. The dorsal ramus gives off a branch like this, which goes into the Z-joint, or the facet joint. That's the medial branch of the dorsal ramus. This would be the lateral branch, and that goes up to supply some of the muscles above, intersegmentally. You'll learn more about muscles next quarter. All right, we have this. That's the gray ramus communicans. Gray ramus communicans. And then we have this. Now this would be coming out of the plane of the page. So that's just the cervical sympathetic chain. And you can't really see it, but there's kind of a little fat part right there. That would be the cervical sympathetic ganglia. If this is C5-ish, that's the middle cervical sympathetic ganglia there. All right, vertebral artery is here. Notice there's 2 vertebral veins, and that's a common theme throughout the body. Remember the gluteal artery? If you ever looked at that closely, it had a couple little veins. There's satellite veins around the gluteal artery. Same with the posterior tibial artery. There's satellite veins. It always has 2, sometimes 3 veins. And I think that is the end of the story. Oh, there's one little weird thing here, too. See that hole right there? It's called the central canal. So we don't have that in the lumbar spine, but cerebrospinal fluid is percolating here in the subarachnoid space. It's also percolating through this little hole. That goes all the way down to the conus medullaris. All right, any questions about that, or are we good? Okay, sounds like we're good. Now let me go find some cervical bones here. And let's see. Get this out of here. There's what we need to see. And there's what we need to see. Right, and I could probably see if I can blow this up a little. There we go. Oh, that's better. Okay, meet atlas and axis. So these are the top 2 bones. Let's work on axis first. You can always tell atlas from axis. So if I put this one to the side, I guess I have to hold it. You can see it's got something really weird going on. Look at that peg right there. So that's the first weirdness. That's called the odontoid process, or the dens. Odontoid process or dens. Let's put it back like this. So we still have the same parts you're used to seeing, only these are a little weird, aren't they? I always call these are like helicopter landing pads for Ant-Man's helicopter. They're really flat, in other words. So you could land a helicopter on there maybe. We haven't seen something like that before. They're very horizontal in orientation, but they're still the same thing. Those are the facets of the superior articular process. Facets of the superior articular process. They match up with atlas. So do you think they match with these? These are very concave looking. See how concave they are? Or do you think they match up with these? And these holes aren't normal, right? That's his skeleton was kind of wired together. Yeah, these match, don't they? These are flat. So this must be the inferior part of atlas here. So atlas would sit on axis just like this. See how that works? Great. They have a special name. Atlas is a very important bone in chiropractic history. I mean, back in the day, maybe even today, maybe even some chiropractors, they only believe in adjusting one bone, and that's this top bone. Not sure how many old-timers are around who still believe that, but there are some philosophies that work with this bone. So, because it's so important, when you name the joint between C1 and C2, you always name atlas first. And you don't say atlas, you say atlanto. So this, I don't know if I can hold it here. This joint right here, that's the atlantoaxial joint. You always say atlas first, atlantoaxial joint. Right? We said that's the dens. So this is the vertebral arch. this whole arch of bone. This would be the pedicle right in this region. Pedicle, kind of hard to see on axis. Lamina, spinous process. It's a bifid spinous process, right? If I turned it upside down, see how it's split? Bifid spinous process. From this upside down view, let's see if I can hold it. You can still see the dens here. But we have some more facets, right? So those are the facets of the inferior articular process of atlas. Here's the whole, the vertebral foramen. Transverse foramen are really weird, right? They come out at a strange angle. In fact, the vertebral artery, V3 of it is born right here. So the tip of my probe would be V3. So it doesn't come, say, let's look at a typical vertebrae. See how the transverse foramen for the vertebral artery, this would be for V2. See how they're straight up and down? If I put axis next to it, you can't see it. If I turn it like that, you can start to see it. But it's at a weird angle, and the vertebral artery gets really kinked right here. So that's kind of a dangerous place for dissecting aneurysm and such. Okay, the body, if we turn it up like this, we can see the body really nice. This is all the vertebral body of axis. This would be the articular pillar, kind of running from here down to here. Transverse processes are a little different too. They're not, I mean, they still have an anterior bar here, posterior bar, but they're not as noticeable as the other ones. So kind of stubby looking transverse processes. And what else? I think that's it. Let's look at some of these facets though. You can see a nice shiny facet. This is where you can see better on the camera, I think, than you can in lab. See that nice shiny facet? That's a facet. That's the facet for the anterior arch of atlas. We'll go over that, what that is in a minute. But that's what that is. If we turn it to the side, these are a little harder to see. There's a facet here, and then there's a facet here. This one you can see nicely right there. See that one there? And then this one's not quite as nice. Those are facets for the alar ligament. The alar ligament attaches right there. Then we have another really important one, a facet back here. You can see it's nice and shiny. That's this facet for the transverse ligament of atlas. Facet for the transverse ligament of atlas. All right, so that is the end. Any questions on that one? Are we good? All right, we're good. Let's go over the atlas. So atlas, what's the first weird thing? This is a anatomical position. It's sitting, you're looking eye to S view of it. What's the first weird thing you notice about it? How about the transverse processes? Well, this one's really long, and this one's really stubby. So this is common to have very asymmetric transverse processes of atlas. This one, next quarter, you'll be taught how to palpate these. And there'll probably be one person in your lab where you can really feel these nicely. But a lot of times you can only feel them on one side of your neck. And this might be in a former life. This person, you could probably palpate the transverse process of atlas nicely here. But on the other side, you couldn't feel it. So that's interesting. But they're still, nevertheless, they're the transverse process of atlas. There's the transverse foramen. So nice, more normal-looking hole there. These are facets of the superior articular process, but they connect with the occiput, which I don't have. The base of the skull would connect right into these. So these are called, remember you always name atlas first, these are called the atlanto-occipital joint. So these are 1/2 members of the atlantal occipital joint. Right. Another very important thing you can see, this one's got a pretty good bump right there. See that? And another nice one right there. See those bumps? Those are called the colliculus atlantis. Colliculus atlantis. And there's a very important and super strong ligament running right across here. Right? And that holds the odontoid process in place. If I put the atlas down, normally we would have a ligament running between here, and it would connect to the facet for the transverse ligament of atlas, and it would go right into there. That's very important. In a car accident, you can sometimes, if it's violent enough, you can rip that ligament, because that ligament is the only thing that's stopping atlas from sliding forward. Remember, your spinal cord is right in this hole. So is that a good thing if this slides forward? No, it's like a guillotine. It chops the spinal cord. You can become paralyzed really easy from that. And so someone in a violent rear end accident in particular, there's some tests you'll learn, and I think it's fourth quarter, to make sure this is stable. You never adjust somebody if this is loose. And you can see in your x-rays, if this is forward more than 3 millimeters, see that there's a gap right here? See the space? It's called the atlantal dens interval, the ADI space. If that's more than 3 millimeters on x-ray, you never adjust the patient. You could kill the patient. So make sure that is nice and tight against there. What else is weird about atlas? Where's the body? Where's the body? Well, if I bring this back, you can see where the body was. This used to be the body. This odontoid process used to be the body of atlas in embryological times, but it's gone now. Stole it. Axis stole its body during embryology. So we don't have a body. All right. Now we have this region right here from here to here. This is the anterior arch. All of this, you can see it from the front as well. Anterior arch from here to here. Right? There's also a bump. See my probe going over that bump? See it sticking out? That's called the anterior tubercle. And some ligaments attached to that we'll talk about next time. Right? On the posterior aspect, let's turn it up a little bit. We have the arch, but this is called the posterior arch. So, weird about atlas, there's no lamina. I mean, these really are lamina, but you don't call it that. This is just called the posterior arch of atlas. And look, it's got a little bump right here. This one's not the... Oh, there you can see it a little more. It's not a really big, prominent one. That's the posterior tubercle of atlas. Got it? Might as well look at this while we're in this position. So we kind of looked at those. Those are the inferior articular processes. Those are the helicopter landing pads. That's half of the atlantoaxial joint. But look at how nice that is. So that's the facet for the dens. Remember on the dens, we saw this one. That's the facet for the anterior arch of atlas. So those two would go right together like that. Okay, we'll talk about that more in lecture. Whoops, I had that upside down. Let's go like that. All right, the other concept is we don't really have a body, but we have these little chunks of bone. So these are really the articular pillars. So all this stuff. Okay, so they have a special name. We've heard it before. It's called the lateral mass. So that's the right lateral mass of atlas. That's the left lateral mass of atlas. Transverse process, transverse process. Right. Let's see. I think that's it. Did I miss anything? Let's go back to this view. Okay, there's right side up. Let's go back to this view. Is probably better. if I turn it up like this again, I'm going to show you this. So there's a nice groove right here. See that? That's the groove for the vertebral artery. Specifically, it's the groove for V3, or part 3 of the vertebral artery lives right there. And sometimes, so we'll talk about a ligament. We looked at it a tiny bit in lecture today. There's a ligament that runs up like this. That's called the posterior atlanto-occipital membrane. It's kind of like a ligamentum flavum type thing. But sometimes in humans, it likes to calcify right here. Only this part, which is really weird. The whole thing doesn't calcify, just from here to here. And therefore, it forms a roof over the vertebral artery. And that's called the posterior ponticle. So I actually have bone. Let you take a look at it and see what you think. Let's see. It's a smaller person. Oh, there you can see it. See it? Right there. There's nothing here. You go right into the groove for the vertebral artery. But here, part of the posterior atlanto-occipital membrane calcified. And oh look, it's created a new hole. See that? That's called the Arcual Foramen, or the Arcuate Foramen, and V3 of the vertebral artery passes through there. It's probably safe to adjust people like this. Back in my day, we were more nervous about these things. They thought it could maybe increase the risk for stroke, but research is not conclusive on that. So I think our clinic doesn't really worry about them. They're very common. This side doesn't have one though, right? There's no tunnel. Where's the tunnel? But over here, there's a tunnel. Okay, so that's kind of neat. We'll talk more about those in class. And I think that should do it. Do we have any questions about anything? Or are we good? As good as possible. All right, all silent. All right, so take off then if you're good to go. Oh, you do have a question? Or is your just shoot your question if you have it. If you're good, you can go. Oh, okay. I will see you guys. When will I see you? Tomorrow for lecture. See you later. You are welcome.
The recording has stopped.